Welcome to Scrambled, your space for fertility, owning your 30s, and the scramble that makes it all worth it. Welcome back to the podcast, everyone. I'm Alyssa.
And I'm Ash.
And today we are taking you on my journey through egg freezing and fertility.
Yeah, so basically we've kind of alluded to the fact that we've both gone through journeys with egg freezing and IVF ourselves. And we've probably gone into it like in some detail to kind of tell everybody what Scrambled's going to be about. But our stories are a little bit more in depth and complicated than what we've really delved into so far, Alyssa. So we sort of thought we'll do an episode each where we get vulnerable and talk about our own journeys because we are asking our guests to do the same thing. So it's only fair that it kind of starts with us. So today, Alyssa's going to tell us about her experience with egg freezing. I'm going to almost like interview you a little bit so we can get the most out of the episode.
Yeah.
You down for that?
Let's do it.
Okay. We spoke in an earlier episode about how you basically found out about your fertility numbers, let's call them, or your stats, because you had a cyst rupture. So should we just dive straight back into that, where it all began and then how many cycles you did and where we're at?
I found out I had an ovarian cyst rupture, took me to the hospital, showed I had low numbers, low ovarian reserve. I was told this, and I was told I should consider freezing my eggs. I was 29 at the time. They thought I would likely need to do multiple rounds because based on what was detected from my blood work, it just seemed like that's what would have to happen. I also keep in mind I'm only freezing eggs, not embryos, and we'll get into this later also, but I just needed a little more security since I don't have a partner. So after finding this out and learning I need to freeze my eggs, I think I also mentioned this on the other episode, but there is a huge waiting period. So that happens. I basically just send myself into a crazy spiral. I have to then apply through insurance and see what they'll cover for the medicines. You then have to order all the medications from a specialty pharmacy. So all of this takes at least 2 weeks, 3 weeks in itself. So I order my meds, insurance covered, luckily, because it's a very expensive process altogether. If you just want to freeze your eggs, being someone who's getting older and for security, likely nothing's covered.
Totally. And I think this is something we're almost going to have to do a separate episode on because financials around IVF and egg freezing really, really vary on different insurances and different countries, for example, as well. But for your journey, what was your experience with your insurance process to get coverage?
My insurance covered my meds. So they didn't cover the freezing cycle, but all my meds were 100% free, which is half of it. So that was amazing. And then I just paid out of pocket for the procedures and the anesthesiologist and whatnot. Certain companies cover it too. Mine does not. If it did, that would be great. Then it would be totally free. But it wasn't. But this was something obviously I felt passionate about. I know I want kids. So I did it. I got the meds, had to wait for my period. And again, during that time, I was just in a bad place because it's anticipation, it's waiting, it's, am I going to get any follicles? Am I going to get any eggs? What's going to happen? They're basically telling me, your numbers are horrible. Let's see what happens.
And can I just quickly jump back maybe to your initial consultation before you even got given the meds and stuff like that? At this consultation, had they set an expectation for you at maybe whether this was going to be a one-off?
You're right. Take a step back. So after I found out from my doctor about she's on ultrasound, it looked off, but I hadn't had any blood tests or anything. So I went in for a fertility consultation. Met with a doctor. They take your blood. They do an ultrasound inside your pelvis. Based on what it looked like and based on the blood work, they said you will likely be doing multiple cycles. So I got lucky that insurance did decide to cover my meds. And I think that's why they did, because of my numbers. Whatever was submitted showed that I would probably have to do it multiple times and that I need some sort of coverage because there's a chance I need IVF in the future.
Right. So for you, it's almost less in the elective basket. This is becoming more of a medical necessity.
Right.
Because the fertility doctor is saying you actually have some infertility issues that we expect if you do try and conceive down the line. So you need an egg freeze for the purpose of potential preservation of fertility.
Yes, for the potential of having fertility issues down the line. Not to say that's going to happen. There's many factors that go into getting pregnant. I mean, even someone with a high ovarian reserve might have their own issues in a different way.
100%. The levels of infertility are endless.
Endless. It's all the stuff we eat and the chemicals and the toxins and the this and the that and the stress.
And there's two sets of people that are involved in making a baby.
Totally.
They can both have their own issues that create infertility. There's abundance.
So for those who don't know, to freeze your eggs, you're basically injecting yourself with a needle multiple times a day for about, give or take, 2 weeks. But I was the type of person growing up who was terrified of needles. I would see a needle, I would faint. I would see a needle, I would pass out. Anytime I had to get a shot, a flu shot, a this, that, they had to bring in 4 nurses to hold me down because I was screaming bloody murder. My mom couldn't help me. One time they even had to prescribe me something.
Wow.
Like a benzo.
Sedative.
Yeah. Because I knew I had to go in to get blood drawn, and either I was going to freak out or I was going to pass out. Which, honestly, passing out would have been better.
And you're not alone. I can't tell you how many people I meet that are completely needle phobic.
Yeah.
And this process of egg freezing is exposure therapy and then some.
Mm-hmm. So this was pretty eye-opening for me. I mean, I have gotten better over the years at shots and this and that, but being 30, I'm still to the point where I have to go like this when I'm getting a flu shot. Like I'm not amazing. It's an anxiety for me. It's a needle phobia. But this obviously changed that completely for me. I was in the mindset, people get scared of how am I going to inject myself in the stomach multiple times a day, and people ask me, like, you being so scared of needles, how did you do that?
Yeah.
And I think my mindset was just, this is my life. These are my babies. I don't care. Yeah. Stick whatever needle you need in me. And no one even had to help me. I did it myself. I was just like, boom, let's go.
To explain to people as well, like, apart from the fact that you are injecting your it's your subcutaneous tissue, so generally we recommend that you do it in your abdomen. You're injecting yourself in the abdomen with, it's a pretty small needle, it's called a subcut, but you also have to go regularly into the clinic and have what we call monitoring, where they do blood draws.
When you're doing the injections, at the first half, you go in every other day to get your blood taken and to get an ultrasound to check how the follicles are growing, how many, what sizes. And then closer to the end, as they're getting bigger, you go in every day just so they can monitor when it's time to go under for the procedure. But I totally forgot that every time you go and you get your blood drawn, my arms were black and blue. And that is almost worse because, yes, you switch arms every time, but there's one good vein in each arm and you're getting the same vein stabbed over and over, and it's brutal. So I would be like sitting there every day just waiting and waiting for the blood to come out. But I got amazing at needles. I still can't look at it. Like, I could never look down. I have to go put my arm out and go like this.
Yeah. But you were obviously looking for your own injections at home.
The injections felt different for some reason. The blood being taken with the vein.
Yeah, that is, I get that. That's way more icky for most people.
And getting an IV put into my hand with the catheter.
Yeah. Some people can't even think about it.
I can't think about that. I can't think about that. But I did it.
Good job. You did it multiple times.
Multiple times. But the injections into the stomach, something about just like a tiny needle with like a solution, it felt different than like drawing something out of your own body. It was putting it in. So I don't know. People ask me how I did it. I've always had a phobia of needles, and I just didn't think twice. Yeah. I immediately was like, oh my gosh. I mean, I definitely had fear of, did I do too much medicine? Did I mix the medication wrong? Did I put too much powder? Like, the medication is all these different vials and tubes, and you watch instructions online and they're not that clear.
I will say that it's one of the only areas of medicine where you put so much on the patient as a responsibility for what they're needing to do at home, in terms of not many conditions medically, except for maybe diabetes and a couple of other things, require you to do like injections to yourself at home to get an end result. Whereas this is like, it's a big responsibility on the patient. And because dosing is slightly different between every individual, even when you're watching the how-to videos, they're saying this is how you prepare it, but you need to know what dose you're taking and alter the preparation based off of your own dosing. So it's a lot of responsibility on patients.
It is. And someone told me it might have been you, but I was just like, what if I'm doing the wrong amount? It was probably you that was like, they wouldn't let you do it at home if it's something that's going to kill you.
Exactly. We would know something was going on based off your lab results. So we're monitoring your hormonal levels through your blood. And we're also doing ultrasounds to see the follicles. We would probably start to see some things going on, like numbers that we wouldn't expect, and be able to predict if you were doing incorrect dosing and things like that at home.
Yeah. And especially when we get to the trigger shot. So basically you do a certain amount of shots every day. Usually people start with the Gonal F and the Menopur.
Depends. There's many names for these kinds of drugs. Yeah.
All I know is the one I did at night burned. The way I had to get that solution into my body was inch by inch because it felt like I was putting fire into my body.
Can I tell you a fun fact about that medication?
I'm scared. Do I want to know if I ever have to do it again?
Yeah.
Okay.
I think it's interesting.
Okay.
We'll get a doctor to explain why we use this specific kind of medication. It's called Menopur in the US anyway. It is made from the urine of menopausal women. Because they release something in their urine that we need. So we purify their urine and put it into a medication. That's why it's called Menopur.
And those two I did all 10 days. About halfway through, I was put on Cetrotide. So I guess I'll say it in like layman's terms and you can back me up. But once your follicles get to a certain point and your estrogen levels get to a certain point, you stop our ovulation.
Kind of,
You
yes.
don't want our eggs to release.
Because I don't know if people realize this, when you get your egg retrieval, so when you come into the clinic and have the actual medical procedure done where we take the eggs out, we are medically ovulating for you. So we do not want you to ovulate.
Right.
Because then we lose the egg. Once that follicle bursts and the fluid releases, the egg leaves.
Out.
We want to go in with a little needle and suck that egg out ourselves so we can take it into the lab. So we need to prevent you from ovulating.
So Cetrotide is the medicine that does that. It pauses it.
It can, yes. The thing about protocols and certain medications and things like that is they're very individualized. So not everyone needs the same kinds of medications. They all serve a purpose for different reasons in different patients. And for you, we were using Cetrotide for that reason. Yeah.
Yes.
But don't be listening thinking, wait, I did an egg freezing cycle and I didn't use that medication. That doesn't mean anything was done wrong for you. It's just very individualized.
I will say when I started the Cetrotide, which was usually the last 4 days, that's when I started getting bloated and moody and felt yucky and slow. Weirdly enough, though, I know, again, everyone's personalized, so everyone has different feelings. My first 5 days when I was on the Gonal F and the Menopur, I was energized. I couldn't drink coffee. I couldn't sleep because had all this all these endorphins. I was shaking so much. You can't work out during this one. I'm like, I need to go on a run. I need to run a marathon. It was like I was on stimulants.
Yeah.
And I know some people feel the opposite. They get moody, they get anxious, they get depressed. I was like best 5 days of my life. So I was like, maybe I'm missing a hormone of some sort.
Well, this is the thing. Your estrogen levels were really high. The woman's brain loves estrogen. So for a lot of people, they experience that. And then when I talk about my story, I was on a medication that was deliberately suppressing my estrogen. So I was the worst version of myself for 3 weeks. Yeah.
Yeah, well, I remember being like, I'm on cloud 9. But then once the Cetrotide hits and I didn't have very bad bloating because I didn't have many follicles. So, but you're crampy and you don't feel like yourself. You feel like sluggish. And so those 4 days, I remember always experiencing that. And then once my follicles got to a certain size, I think my biggest ones they let my biggest one get pretty big to let the others grow. I think my biggest one got to like 26 millimeters at some point.
When we say these measurements, we're talking about the fluid-filled sac, which is called a follicle. And that's what we're measuring when we're doing your internal ultrasounds. I think people get a bit confused, and we'll have doctors explain this to people when they come on the pod. There is a difference between a follicle and an egg.
The way they explained it to me, which is, in my opinion, the easiest, is the follicle is the egg's house.
Correct. 100%.
So when the follicle grows, so does the egg within the follicle. It's literally the house. As you said before, in a natural pregnancy, the follicle will release the egg down the fallopian tube. Then it can connect with the sperm to create a baby.
Yeah. So when the follicle bursts, that's called ovulation.
Yes.
Yeah.
And in this situation, we're not allowing the follicles to burst because you're putting me under to go in and extract the egg from the follicle so we can get multiple at once.
Correct. And I think where people get a little confused sometimes, because what might happen is you might be having your scans during your lead up to your retrieval. So they're counting your follicles. Some clinics won't tell people how many they're counting because there can be discrepancy and it gets a bit confusing for people. Other places are really upfront. Certain patients might ask more questions than others and they'll get different levels of information off their provider. But I think what gets confusing is people count these numbers the whole way along and they completely write on it and they're like, well, I've had 12 follicles, so I'm going to get 12 eggs. The other thing is when you're doing an ultrasound, you're limited to what you can see. So you're taking a 2D image of a 3D structure. So sometimes if there's large follicles at the front of the ovary that we're seeing, they might be blocking smaller follicles living behind them. So the more condensed the the follicles are getting within the ovaries can make the numbers a little bit harder to predict as well. So sometimes you get a higher number than what we've been counting. So there's just like all these different things that go on. But I think that's a totally important thing to flag, because my experience as a nurse looking after people is that level of education might not be there, or people get confused about that. So I think when we get a doctor on, I'm going to really go into depth about asking them questions about this, because that is a big point of confusion for most patients, is they're really confused about how come those numbers don't always match up.
Yeah. Yeah. The follicles, too, just like inside for more clarity, they literally look like little golf balls. And when you get the ultrasound, obviously they expand it and they measure it, and they're in millimeters. They're tiny.
They're tiny.
And the egg is microscopic, but they literally just look like these little balls. These balls. On my left ovary, I always had like 1 or 2. Nothing more ever grew.
So you did, and we'll get into this in just a sec, you did more than one cycle. Was the left always the underperformer?
The left was, I've never had more than 2 in my left side.
That is fascinating.
They did say sometimes, I guess your bowel's on your left, and sometimes that can obstruct the ovary. I don't know. And it can mess things up. Whereas my right side, I always had multiple growing.
Yeah, interesting.
So everything came from my right side pretty much. But the 2 on my left side always produced, and I always got an egg from them.
Yeah.
And honestly, they were always the biggest ones. They grew the fastest. But they had some freedom in there. They could run around. They could run around. But yeah, so I always had 2 on the left, multiple on the right. After the Cetrotide, once your follicles get to a certain level, it's time to do a trigger shot, which is basically doing what?
So the trigger shot serves a couple of purposes. So we usually, for most patients, depending on their specific protocol, but for most people, 36 hours before they come into the clinic to have their procedure done, they take a trigger shot medication. So it's another injection into the abdomen. And some clinics might do it differently, but for a lot of people, it's just an injection into the abdomen. And it's triggering ovulation, but we're going to take your eggs out before you ovulate. That's the aim of the game. So that's giving the final push of maturity to all of those follicles. And it's telling them, like, it's go time. In 36 hours, we're going to ovulate. But instead of you ovulating, a doctor's going to perform a procedure to take your
Why
eggs out.
36 hours? They've just figured out that that's the time of the body.
It's basically the way the medication works. That's like the time frame around which it causes the final ovulation.
And why did I have a dual trigger? I had 2 trigger shots.
Yeah, so everyone is a little different. You probably had something called HCG, which is human growth hormone, and maybe Lupron.
Lupron.
Yep. Again, we'll get docs to go into like all the pharmacology. We might even be able to get a pharmacist on that can explain this stuff like in a lot more depth.
I have a question. I've heard multiple stories where someone goes through egg freezing or embryo freezing and then does the retrieval, gets their period after, then has sex, and then gets naturally pregnant. Is that because the hormones are still allowing more than 1 egg to release?
It shouldn't be. Once you've had your period, you should be back to baseline.
Right.
Maybe we need to ask a doctor this question. I don't know. There probably has been research done into it, and there probably is more to it. We advise that once you've had a period, you're safe for multiple reasons to have sex again. You should be back at baseline, and you should just, your next cycle should be a regular cycle.
It's weird though. I've heard multiple
You hear it a lot.
IVF to natural.
You hear it a lot. You hear of people that go through IVF treatment multiple years and things like that, and then the time that they finally stop and go, you know what, we've had enough, and they'll naturally conceive a child. Shouldn't say naturally, that's not a good word. I think we should say spontaneously conceive a child. Maybe that's just fate. I don't know. Maybe that's reduced stress levels.
Yeah.
Who knows?
Crazy.
Anyway, let's get back to you.
That's crazy though.
You've done all your meds, you've taken your trigger injection. You're now going to be coming into the clinic for your first ever egg retrieval.
Yes.
How are you feeling?
Physically, I felt fine. I was at like 6 a.m. Mentally, obviously, I was really nervous. It's never exciting to know you're being put under anesthesia. I mean, although it's twilight, it's nothing, and the procedure's, 10 minutes? It's still scary to go under. You never know.
There's risks related to any time that you receive any medications.
Yeah, but the anesthesiologist was amazing. I was nervous, but I was more just ready to get my results, see what happened. Would I get any? Would I get a little? Would I get a lot? And then what are next steps from there?
Totally.
A lot of my anxiety was anticipation anxiety. Anticipation to start the shots. Anticipation if follicles would grow. Anticipation if follicles contained eggs. And anticipation if the eggs would freeze.
Yeah. And I think, unfortunately, like the other thing is you might get results on the day of your retrieval, but they're not always they're not your final result
They're
either.
not.
There's so much anticipation in this process for waiting for the next thing.
Yeah.
And it's hard because, like, I don't know about you, but like I've really, especially as I'm getting older and I feel like the years are going so quickly, I'm constantly trying to like live in the moment.
Yeah.
This is one of those times in your life where you're constantly thinking about the next step and just wanting to get to it.
I don't even know if everyone feels that way, but yes. The first round, I had 6 eggs retrieved and 5 froze. The second, I had 7 retrieved and 7 froze. So that's 100%, which is great. But this doesn't mean anything about the health of the egg.
No, it just means that your follicles did a good job at creating mature eggs.
Good.
You can't create an embryo with an immature egg at this point. So you need these mature ones in the freezer. They're the ones that have a chance to become an embryo.
The third round, I remember I was bummed. You were here, you changed your schedule to be with me, and thank God you did, because I had like 13 or 14 or 15 follicles growing. Like at this point, I'd been stimulated 3 times almost in a row. So I was like, let's go, let's be done. And then we only got 4. The doctor recommended I do 1 more cycle because how many frozen eggs do they want per embryo per kid?
I think every doc is going to recommend you a slightly different amount, but I think for the average egg freezer, they say to have 10 frozen eggs to 1 hopeful child.
Right. Because 10 eggs, then you defrost them. You can lose some in the defrosting process, and then they have to combine with the embryo, and the embryo gets tested, and you could lose more on each time. So I think you're right. I think it's 10 per child, but I think the younger you are, the lower that number is.
Well, the thing is, it comes down to other factors as well. It comes down to the quality of the eggs as well. A higher quality egg is going to cope better in the freezing and unfreezing. It's going to behave better once sperm gets to it in terms of becoming an embryo. Once it becomes a day 1 embryo, it also needs to grow into a blastocyst. And so there's many steps. Even then, once it's a blastocyst, we want to genetically test it and get a genetically normal euploid embryo. And then that also has to implant. There's so many factors.
There's so many factors.
It's a miracle anyone falls pregnant spontaneously.
No, seriously. It's like, wow, natural pregnancies are...
Wow.
The human female body, male body too, but female body is really insane.
Well, that's another thing we need to touch on is that once the egg is defrosted and sperm's introduced, that sperm quality is a whole other thing as well.
Yeah.
Because there's many factors of male infertility as well. So that's a whole other section of it. Yeah.
So at that point, after those 3 rounds, I had 16 that froze. And I would say a person with average AMH, the doctors would be like, you're good. This is more security. We're all good. Your ovarian reserve is great, and you have a couple years.
Yeah, and you might not ever have to go and use those eggs.
Right. If my ovarian reserve is already this low, it will continue declining because that's what happens. As you get older, you lose eggs until you get to menopause. But there's no science to find out how quickly it will decline. So my doctor advised just doing 1 more round just to be safe. I only had 16 eggs. Goal was 20. I don't know how many kids I want, but at least 2, if not 3. In a perfect world, 4, but who has the money for that these days? Who knows where I'll be living. So I did 1 more round, and I was excited about this round. They ended up retrieving 11 eggs, which was crazy for me.
And was I there for that one? Or
No,
did I miss that
you
one?
missed that one.
Which is so frustrating because not that I'm obviously want to be there for you in like the hard times as well. But the last retrieval I'd been with you for was your 4 egg, which you were bummed about. And I understand that.
Maybe it was good luck that you weren't there.
Well, that's what I ended up saying. I was like, maybe I shouldn't be here because
there.
I'm in a different location and you suddenly get 11? Okay.
Yeah. Only 8 of those froze. So that was the lowest ratio, but that's okay because I still got 8. So I ended up with 24 frozen eggs. I'm happy. I'm good. I feel great. Hopefully I meet someone and quickly have a baby because I'm so ready. But yeah, that was it. And by 2nd, 3rd, and 4th retrieval, I was just like, put the IV in.
You were an expert.
I was best friends with the anesthesiologist. I was like, please just give me 10 extra seconds. So they'd be like, okay, because you've been here so many times, like I'll give you like 2 extra seconds before we put you under because it's fun. You're high. Best feeling ever. But the procedure's literally 10 minutes. I woke up. I could walk out of there in 15 minutes. Felt fine. I mean, you're crampy when you wake up. Sometimes I was bleeding. But within a day or 2, I felt great. And then about 5 to 7 days later, you get your period because your estrogen drops really quickly once you're off the hormones, and then you're back to normal.
The kind of trigger shot you take will usually indicate how many days until you get your period. That's another thing as well. So can we just talk about, so you did 4 cycles in total to get your 24 in the freezer. So they're living frozen right now. Living frozen?
Yeah, my popsicles.
Yeah, I guess so. Little popsicle babies. I want to talk about the different cycles. Did you feel different through each of them? Did you do the same medication protocol in each of them?
I felt pretty much the same through all. I did the same medication through every single one. So I was on the highest dosages pretty much for all. And they were happy with my results because based on the number of follicles that were growing, how many eggs that they were retrieving was pretty good.
Yeah, like basically from your first was such a good retention rate and such a good cycle.
Yeah.
Your doctor probably went like, we're on the money
Let's
here.
do this
Let's
again.
keep going at the same trajectory. And you were having leftover medication to then use in your next cycle?
Yes, I did from 1 cycle to 4. The time of injections decreased by like a day or 2.
Okay, so your actual cycles, the amount of days you were taking the meds for was decreasing.
I guess my body was getting used to the hormones
Maybe.
and digesting them. I don't know.
Were you someone who, so this is a question that comes up a lot. I get asked it a lot and I always advise that people talk to their doctor about it. Were you doing what we call a back-to-back cycle? So were you getting a period and coming right back in?
What ended up happening was I wanted to do back-to-back cycles. So after the first round and the injections, I had to wait to get my period for the second cycle. I flew home for Thanksgiving. That day, I got my period. So what I ended up doing was I called the doctor. They put me on the birth control pill for 1 day to hold me over. I flew home, I went off the pill, and I started injections the next day.
Yeah, it blows people's mind the way that we can do that.
Yeah.
It's not uncommon. So if you ever go in for a consultation and you want a bit of control around when things happen, it's not uncommon to be put on birth control so that we can keep you in a certain stage of your cycle to be able to start treatment at certain times.
Yeah. Yeah. So I remember I was like, are you kidding? I just landed and I have my period. But I was like, it's okay. I have 1 day here, 1 day and a half. Saw my family, go home through Thanksgiving. I ended up doing Thanksgiving with my friend locally. It was fine. I started shots. Again, this was my second time. I felt like I was a pro. It was all good. And then I took a break because it was December, the holidays. I was traveling. Then I had a bunch of travels, weddings, I think January, February, March, April. No, January, February, March. And then I started again in April. So then I did 2 more back-to-backs, April and May. Then it was summer. And similar to the needle question that I was getting, though, people were asking me, how are you doing this? It's so taxing on your body. It's constant. And like I think for me, my mindset was just so different because I was just like, I know I have to do this. It's not really optional for me. Of course it's optional, but just for my future, it's not optional. And I put everything else in the back of my head and just did it.
Yeah. And I said to you in a previous episode that I found that so inspiring, that you were just like, so I have an issue. I've been provided with a solution. It's a tough one, but I'm going all in. I'm doing it. You changed your diet, your lifestyle. You embraced it and you just went for it. And to be honest, it was enough to make me go, why am I sitting here ignoring this? Like, I need to go and sort some stuff out for myself.
Why not? I mean, because it's expensive. But for me, majority was covered. And then, like you said, I had medicines that would filter over so I could just keep going and going. I never paid for medicine once. And actually, at the end, I gave the medicines to my sister and she had leftover and then she gave the medicines to you. So it was just like, because her meds weren't covered and I don't think yours were.
No, they weren't.
So free meds for all. But yeah, I mean, that's pretty much my story. 24 frozen eggs. The time will tell if I have to use them. Time will tell if they defrost and they're healthy. There's still a lot of unknown, but I've kind of learned to manage in my head that anticipation anxiety because right now there's nothing I can do.
Yeah.
I just know I want babies in the future. And if I have to go other avenues, I go other avenues. But it feels like a hint of security. I've thought about doing another round. It's not something I would do now if I still don't have a kid at 35. Maybe I'd consider it because at that point I might need more eggs and more options as I get older, as my ovarian reserve decreases and decreases.
Sure. Can I ask you maybe a personal question?
Yeah.
When you meet people, so let's say you're out on a date or maybe you're getting to know a guy and you think like there's a potential here or maybe there isn't, maybe you're just like on a date. Do you ever bring this up? Like, are you someone that goes into any of this?
No. I don't bring this up, but something that's always in the back of my mind, meeting a boy is, will they be a good dad and number one, and two, are they ready to have kids?
Interesting. Because you're looking for someone that is ready to have kids.
I'm looking for someone that's ready to have kids, but I also date only young people, younger
Alyssa
people
makes
than me.
no sense.
I make no sense. It's like my toxic trait. It's like I want babies, but I'm not ready to give up like my toxic single girl lifestyle. So I only date younger because they're a better energy match for me. I like to go out. I like to do things. I like to do dinners, drinks.
I tell her you can find both.
You can find both. I just haven't yet.
You haven't yet.
Yes,
Exactly.
I
You
haven't
haven't
yet.
found your perfect person. And that's a whole other story in
Yes.
itself. Like, oh my God, it's the hardest thing in the world. But it is funny because your
I made a baby
track
yesterday,
record,
but can only
But
date
dates
someone below
babies.
the age of 28. I'm 31. Cool. Well, thank you. We'll see you next time.
See you next time.
Hopefully
Thanks
this
for listening.
recorded.
Bye.
Bye.